So potential areas of litigation in this, it is one is diagnosis error, medication error, blood transfusion. These are the most common areas where litigations are being held against the doctors. Okay, certain landmark cases in the British period was given in the textbook that you can read later. Okay, but the other landmark cases we will discuss pertaining to what happens in the Consumer Protection Act. We will discuss that in detail. Okay, so these are the three main areas: diagnostic error, medication error, and blood transfusion error. In these errors, most of the litigations take place. Some court suits, etc., are filed against the doctors. So diagnostic errors, some examples of it: failure to diagnose. Failure to diagnose is not something against which a doctor can be charged. Okay, usually it does not happen like that. For example, in failure to diagnose, there are two cases which they have mentioned in the textbook. One is Aruna Trika versus Sehra Medical Center, and another is Dr. R.K. Sharma versus Srimati Murthy Devi. Okay, so in the first case, the patient was undergoing a lot of fever based symptoms, and what it was diagnosed was, in Sehra Medical Center, they diagnosed it as UTI, typhoid, and malaria based on the symptoms what the patient was having. But when the patient was referred to AIMS, and there also the same treatment for the same situation continued for 5 days, and again the patient was put under certain ADT. That's when they diagnosed it. It is a tubercular meningitis, tuberculosis, which has affected the brain cells. Okay, and she recovered completely. There was no loss of life or any function, but still, since in Sehra Medical Center, the doctor was not able to diagnose it on time. A case was filed against the doctor, but there was no. The complaint was dismissed. Yeah. So the complaint was dismissed in the Sehra Medical Center, the case filed against Sehra Medical Center, because failure to diagnose a situation or a disease condition is not a foundation to file a case against doctor. Okay, and the second situation was between Dr. R.K. Sharma and and Srimati Murthy Devi, in which she was the husband, not the person, but the husband was diagnosed with sarcoidosis after 8 months of treatment of tuberculosis drug. He was not suffering from tuberculosis, but the symptoms of tuberculosis and sarcoidosis is similar in the early stages. Okay, so it was misdiagnosed as tuberculosis, and the patient was put on tuberculosis drugs for 8 months. There was no recovery at all. There was no change in the patient situation, and then the patient was referred to AIMS, and there also sarcoidosis, it was advanced stage, was diagnosed later in AIMS, and that's when they went ahead with the complaint and the litigation that why did you put my husband in on anti-tuberculosis drugs for 8 months when it was not even the diagnosis. So that was the basis of this case. But again, it was understood that the patient did die subsequently because of the advanced stage. The wife did lose her husband. That's why the wife went for the complaint. Okay, but it was not held. Okay, the doctors or the hospital where it was shown earlier, where the patient was put on anti-tuberculosis drugs, it was the patient, the doctor was not held responsible, neither was the hospital, because the reason being the early signs and symptoms of tuberculosis and sarcoidosis are quite similar. So it was an unfortunate misdiagnosis. Okay, and because of the misdiagnosis, wrong medication was given, which continued for a pretty long time, and sarcoidosis, it got into an advanced stage from which the patient could not be saved. Okay, so still the doctor and the medical institute was not held responsible, but even though there was a litigation filed. Okay, Then wrong diagnosis. Two examples are there. One is the wrong diagnosis of gastric ulcer, another is the wrong diagnosis of pulmonary tuberculosis. Okay, in gastric ulcer, in Rajiv Kumar versus Dr. V.K. Vikas, patient was complaining of severe abdominal pain, etc., and barium meal diagnosis was given, but barium solution they have to swallow it, and X-ray is taken. Okay, ultrasound, etc., was done, and there was a diagnosis of gastric ulcer which was made, but still the pain didn't reduce. The pain continued for 10 months, and the patient was advised for an operation by another doctor, and it was seen that it was not gastric ulcer, but it was appendicitis. Okay, and the patient cured. No life was lost. The patient was cured, but the treating doctor who treated them based on peptic ulcer, the treating doctor was not held negligent because the reports were not consistent with the diagnosis of appendicitis. There was no way through which appendicitis could have been diagnosed here. Okay, maybe the patient may had peptic ulcer. It was not aggravated, but it was not the cause of pain. It was the peptic ulcer which was the cause of pain. Okay, so wrong diagnosis of pulmonary tuberculosis. Second case in Sukhchain Singh versus Chandigarh administration. There was a allegation that a wrong diagnosis of pulmonary tuberculosis, and the medication was also started, and this medication led to some complication. X-ray, chest X-ray was also submitted, which told that there was no tuberculosis at all. Okay, but again, since the patient was already on anti-tuberculosis drugs, and the patient denied any sputum positive diagnosis, the complaint failed to establish the negligence of doctor because the case was dismissed. The patient didn't support to do further any further diagnosis. The patient willingly took the medications, and since there was no tuberculosis, but still the patient took medication. Medication led to complication, and the patient was not even ready to go for a sputum analysis. The patient denied to do a sputum analysis. So based on all these factors, the case was dismissed. There was no one held responsible. Okay, so these are the areas through which a litigation can be filed, even though whatever is the result of the case. Okay, in all these cases which we have seen, the doctor or the hospital is not held responsible, but still they have to go through a lot of steps to prove it. Okay, a lot of time and resources from the healthcare center, from the medical care center, health hospitals, or from the doctors treating time also could have been wasted on all these cases. So that's the reason why one has to identify what are the major reasons through which litigations can come, and it can waste a lot of time and resources for the medical practitioners. Then certain litigations related to medication errors. One is overdose of medication, in which the doctor was held negligent. This was a case against Dr. Kunal Saha, Balaram Prasad versus Kunal Saha, and others as well. And here 6 crore rupees was a huge amount of compensation which was given by the medical practitioner. The compensation was given to Balaram Prasad's family for the death of the wife of the petitioner, Balaram Saha's wife, who had developed some toxic epidermal necrolysis during her visit to Calcutta, and she was administered on high-dose steroid, which, according to the court, it was a negligent act because there was no way of modifying the drug dosage depending on one's personal experience, but the method of changing the dose, that was not correct. Okay, so that was the reason why it led to overdose. And this high dose of medication was not necessary to treat the patient's condition. Okay, based on her age, based on her underlying situation, these things were not considered, and directly high dose of steroid was given to the patient, which subsequently led to the death of the patient. Okay, and then again 6 crore rupees compensation was given to the aggrieving family. So here, in overdose of medication, the doctors and the institute was held responsible. In wrong medication, there was a case against Spring Meadows Hospital versus Harjot Ahwalia. And in this case, the nurse gave intravenous injection of chloroquine instead of chloramphenicol. So wrong medication was given for the treatment of enteric fever and in the child, leading to cardiac arrest and brain damage of the child, which is permanent damage. So Supreme Court did held the nurse negligent, and the assistant doctor also was negligent, and the hospital was also vicariously liable. Okay, a compensation of 12 lakh rupees was given to the child, and 5 lakh rupees was given to the parents, because the parents have to invest a lot of time and effort to be a caretaker of this of the child. Okay, for the child's better physical physiotherapy and further medication needs, 12 lakh rupees for the child and 5 lakh rupees for the parents was awarded. So here the nurse misread the medication as chloramphenicol instead of chloroquine. Okay, and that's why it led to this grave complication. So again, the doctors, nurse, and the hospital itself was held negligently. Side effects of medication. The result was nobody's negligent here. Doctors will not be held negligent for side effects of medication. There was a case against Muhammad Ishfaq versus Dr. Martin D'Souza, where the patient was suffering from chronic kidney disease. Okay, the patient was advised on antibiotic amikacin 500 mg injection twice a day for 4 days, and discharge slip for another 10 days was also given. But by the time the course was over, complainant lost his hearing, and in this case, the dose was not modulated or well established on the after antibiotics starts to work, you have to modify the dose. Okay, so that was not done. So the patient was not even referred to ENT when he complained of hearing loss. Hearing impairment was found to be because of overdose of amikacin, but still negligence was held then. But although hearing could not be regained fully, at least it could be partially regained by the cochlear implant surgery, which cost around 4 lakhs. So the 4 lakh rupees was given just for the surgery, but here nobody was held responsible. Okay, and 2 lakh rupees was given just because of the mental agony, and the harassment cost of 5,000 rupees also given. So this was what was given to the patient. But here there was no negligence. Since it is a side effect, the doctor cannot be held on medical negligence. Okay, so even though the patient got the compensation, patient got the money for cochlear implantation surgery, for the mental agony what he or she went through, and the harassment compensation was also given. Okay, compensation was given, but nobody was held responsible for this situation. Then wrong route administration of medication. Shamlal, Dr. Shamlal versus Mrs. Saroj Rani. So here the patient was advised on injection Proluton depot to be given intramuscularly, but it was given intravenously, and which led to cardiac arrest and death of the patient. Okay, so negligence was held and the compensation was given. Prescription of allopathic medications by homeopath, it is definitely a medical negligence. It's called quack. If you are not familiar with a particular stream of medical practice, you are not supposed to give medications on that. Whoever is found guilty doing this, okay, you are qualified from another stream of medical practice, but you are prescribing from another stream of medical practice. It's called quacks. Definitely the person will be tried in the case court. Known complication. If the doctors or the medical practitioners are aware of specific complications of the medication, and if that medication complication takes place, it's also not a form of negligence. Okay, so in case of Dipti Sarkar versus Steel Authority of India, the person who passed away was bitten by a cat, and her mother was the one who took her to the hospital, where rabies medication was started. Okay, anti-rabies vaccine was started, and over a period of time, the patient complained of gradual weakness in the lower limbs, and the patient was hospitalized. And within certain days, within 10 days or something, the patient complained in difficulty in swallowing, and then she was shifted to the ICU as well. The patient was put on ventilator as well. Okay, and some symptomatic treatment was done. However, it was root cause was not able to analyze, and slowly the condition deteriorated, and the person and the girl passed away. Okay, and her mother complained that her daughter passed away due to the negligence and the maltreatment by the doctors. However, it was dismissed that it was a complication in the of the anti-rabies medication which was given, which was indicated in cat pies, and there is an it is known that there is an evidence that a paralytic shock reaction can take place because of this particular vaccine. That's a well-known complication. And besides that, doctors have taken all the care. Doctors have given all the symptomatic management to the woman, however long she was admitted. Care was given, symptomatic care was given. But if a well-known complication takes place because of the medication, that is not a strong foundation to file a charge, file a case, or punish the doctors. Okay, so these are the areas where medication errors and litigations take place. Okay. Next, litigations which revolves around the blood transfusion, mismatched blood transfusion, which happened in a post-graduation institute of Chandigarh versus Jaspal Singh. Here, Srimati Harjit Singh, the wife of the complainant, and the mother of the child, mother of the complainant, received accidental burns while making tea on the stove. She sustained around 50% of third-degree burns involving both upper limbs, part of the trunk, etc., lower limbs as well. And the patient, Srimati Kaur, was taken to the Dayanand Medical College, Ludhiana. Immediately, she responded to the treatment. Since the treatment at this particular Dayanand Medical College and Hospital was expensive, he decided to move his wife to PGI Institute for further treatment. And also he saw that the condition was improving. So for further treatment, the patient was moved to another institution. And here, Dr. Varun Kusheshtra, a senior resident from the Department of Plastic Surgery, did attend her. Condition also started improving, but she was transfused. The blood transfusion was A positive, which was her which was her blood group, but she was given B positive. Okay, and even though her blood group was A positive, she received a B positive blood group. And on the night of May 20th, the urine of the patient was reddish like blood, and the attendant nurse informed the hospital immediately. And because of her bad luck, the next day also the patient was given B positive blood. Again, the same wrong blood was transfused, and the condition of the patient became serious. Her hemoglobin level fell down, urea level went high, and the patient got deranged slowly. Okay, within 24 hours, she got her condition deteriorated. And then when the complaint was returned to the head of the department in plastic surgery, informing that there could be a chance of mismatched transfusion, whereupon inquiry was done, and it was found that wrong transfusion of blood was given 2 times. Okay, and the patient's condition also started deteriorating, and she passed away before anything else could have been done. Okay, so the statement given by the doctor and the hospital staff that she survived the acute phase, and ultimately she died due to septicemia, and it is not because of mismatched transfusion. They try to hide it. Okay, and later it was found out. Okay, so the PGI, the Postgraduate Institute, was found guilty, and the institute had to pay for the negligence. Okay, the agreed family received the negligence compensation. Okay, so they, first of all, they did something wrong, but they also tried to hide it. The statement given was the patient died of septicemia. The patient didn't die of wrong blood transfusion. But it was observed that the patient survived for 40 days. Okay, after the mismatched transfusion, but that again cannot be said that there was no causal link between the mismatched transfusion and the death. So that's why PGI staff and the hospital was held negligent. Okay. In emergency, there was a case of Siddiq Iqbal Khan versus the Child Trust Hospital. in Madras. 6-month-old baby was admitted and was referred from Pondicherry. After admission, the patient received blood transfusion. The baby was B positive, and the baby was given AB positive blood, which was not was given the B positive blood, but the child was having AB positive blood group, which was not available. So B positive wrong blood transfusion was given, and 3 more units of and later on the baby received 3 more units of correct blood group later. Okay, and the complainant came to know that the baby had received the blood transfusion which was of a wrong group. The baby was seriously ill. She had to undergo dialysis, and the complainant took away the baby against medical advice. A LAMA was filed, and the patient was taken to CMC Vellore. But on the way, the patient passed away. The baby passed away. Okay, and the negligence was given that the complaint was raised that it was due to the wrong blood transfusion of wrong group that the baby passed away, and they claimed a compensation of mental agony towards the expenses that have been incurred. But the opposite party, that is the hospital, claimed that the baby was admitted in a very serious condition. She was suffering from hemolytic uremic syndrome. She had renal failure, hypotension, and thrombocytopenia. To save the life of the baby, urgent blood transfusion was needed. And at that time, AB positive blood was not available, so they had to go with B positive blood, which was transfused even after cross matching. Okay, and in spite of the serious condition, the complainant left the hospital against medical advice. Okay, they claimed that if they were given more time, they could have saved the baby. Okay, but it was an emergency decision to give at least B positive blood group just to save the child's life instead of AB positive, and based on that grounds, the case was dismissed without any cost, without any compensation given to the parents. Then transfusion associated with hepatitis C and hepatitis B in Apollo Hospital, Indraprastha Apollo Hospital. A patient who was having a high fever and low platelet count, they got blood transfusion from 5 different donors, and the patient got infected with hepatitis C. And there was no explanation why platelet transfusion was not done from the patient's mother's blood, which was much safer option. But hospital transmission records were also not maintained properly. Because of this, 18 lakh rupees of compensation was given to the medical treatment incurred till date, and the cost of future medication expenses also, just because the hospital was not keeping proper records of the blood donors. Because of blood coming from 5 different donors, one of them may be infected with hepatitis C, and the patient who received it got infected with that. Litigation in diabetes, delay in diagnosis or suboptimal treatment of diabetes. There was a case of Dr. Mani Bhargava versus P.K. Sinha. So here the patient was known to have diabetes, but the patient was on medication as well, and admitted in a comatose state at night. And during her stay in this hospital, her condition deteriorated. Next day, she was referred to Aligarh Medical College without proper referral, and she died before she could even reach the medical college. It was the case was filed that the doctors at the hospital failed to diagnose the diabetic ketoacidosis and give insufficient and they gave insufficient treatment, resulting in the death. But the expert panel at AIIMS observed that records suggest that she developed diabetic ketosis with septicemia. And going by the documents, it appears that there was a delay in making correct diagnosis and initial therapy. Therapy provided was suboptimal, and it was not monitored properly. Okay, and absence of any detailed medical reports. Because of that, you cannot go further with this hearing. And based on that, AIIMS expert panel directed that Dr. Sanjay Bhargava in the hospital has to pay a sum of rupees 8 lakh with interest for the deficiency in treatment, even when they knew the patient is diabetic, and taking a correct diagnosis and taking correct giving them correct treatment was the duty of the hospital and the doctors, which was not performed. So based on that grounds, 8 lakh rupees of compensation was given to this patient. Then another case of diabetes with septicemia patient taken care by pharmacist. Here it was a nursing home, not a hospital. So the diabetic patient was suffering from high grade fever, and the patient was brought in a very serious condition, and the patient was diagnosed with diabetes along with UTI and septicemia. And the treatment was also given by Dr. Vedanath Mishra, who was a specialist in medicine. And the patient throughout the night was looked after by a pharmacist, not a doctor or a nurse, okay, by a pharmacist who took care of the patient throughout the night. The doctor handed over the case to the pharmacist at night, and in the morning, the patient passed away. So here, the district forum as well as the national commission held the physician, Dr. Vedanath Mishra, responsible, and the compensation was awarded to the complainant and her family members. Because once you know that it is a very serious case of septicemia with high grade fever, and when you are handing over your patient to be looked after at night, it should be someone who has a medical degree or somebody who has a clinical practice to look after such a serious case. You can't expect a pharmacist to look after such serious cases. So based on that, definitely this is a case of gross medical negligence and malpractice. So the doctor was held responsible and compensation was awarded. Litigation in cardiology. Negligent post-operative care. There was a patient who underwent Sheila Hirba Naik versus Apollo Hospital, Chennai. Patient underwent angioplasty, and the patient was placed with stents. But later, the patient collapsed on the way to bathroom. Okay, clinical examination was done, and no ECG or blood test was also not done. But clinical examination was only thing that was done. Subsequently, the patient developed cardiac arrest and died soon after the fall. And the National Commission observed that even though angioplasty was carried out successfully, stent was also placed successfully, but post-operative care was the area where it was deficient. Okay, proper post-operative treatment was not given. So only in that area, since there was a failure in post-operative care, 2 lakh rupees was awarded as a compensation. Non-referral to cardiologist. This is a case between Dr. N.K. Jain and Mr. S.C. Gupta. Patient had developed chest pain, visited Dr. Jain, who did an ECG and prescribed him some medication. And after a few days, again, the same complaints happened, and the patient again visited Dr. Jain, who prescribed him some antibiotics and anti-allergic medication. After 6 months, the patient was admitted in SGPGI Hospital, Lucknow, where diagnosis was made that diagnosis of IWMI was made, so myocardial infarction, okay, was made, which was not thrombolized during the earlier visit. Means thrombolysis or aspirin medication was not given during the earlier visit to Dr. J. So later he went to Apollo Hospital, where the bypass surgery was done. And after that surgery, complaint against Dr. Jain was lodged in the court, alleging that he didn't even interpret the ECG properly, which was taken earlier. And based on the ECG, thrombolysis medication should have been started. That was also not started. So the district forum did allow this complainant and directed the doctor to pay the sum of 2,50,000 rupees to the complainant for whatever medical expenses they have to go through because of the delay in getting the proper treatment and the proper diagnosis. That is non-referral to cardiologist. Then wrong diagnosis. In the case of V. Chandrasekhar versus Malar Hospital, the patient was diagnosed to be suffering from single vessel disease in one hospital, and another hospital diagnosed it as some other case as a triple vessel disease. So it was held that the diagnosis is nothing but forming an opinion on the examination of the patient. So diagnosis may consist of physical as well as mechanical examination. So the opinion formed from one medical expert to another medical expert's opinion, it could be different. Okay, just like the difference of opinions lawyers have. Okay, so wrong diagnosis and the consequent treatment given cannot amount to any form of negligence here or deficiency in service, just because two medical practitioners had two different opinions of what is going on with the patient. And in whatever choice the patient take forward with in treatment, does not mean that it's a medical negligence because the doctors was not able to come to correct diagnosis. That doesn't give the foundation to go for a medical negligence. Then the litigation in gastroenterology. Some examples: failure to attend in case of Dr. Sunil Rungta versus Dr. Chandrasekhar Agarwal. The patient was suffering from hematemesis, that is blood in vomiting, and melena, blood in feces, and was admitted in ICU. The patient, the physician, whoever under whom the patient was getting admitted, failed to even visit after the information was given by the junior doctor on duty, and repeated request from the complainant also. The visit was not made by the doctor. So the complainant has also paid money for pathological test. Sample was not collected. Okay, endoscopy test was not done, and on time. The consultation was also not done with the surgeon, was also not done on time. Hospital along with the treating physician in charge of pathology were held negligent, and compensation was awarded. Okay, because even though the payment was done, everything was done, it was the duty of the doctors and the hospitals to show up with their services, skills, and consultation. And the delay in which could have caused some grave failure, it could have also led to death or shock or any irreversible motor function. Okay, but still a negligent was held here because there was a delay in giving the treatment. Even after they got the information, proper treatment on time was not given. So that is a failure to attend situation. Failure to diagnose: Dr. Sanjeev Mankala versus Dr. Ajit Sood. So here the patient was suffering from a pain in abdominal pain on and off, and the upper GI endoscopy was done. Diagnosis was of an esophageal ulcer was made. The patient was given some treatment, but there was no relief at all. Later, CT scan was done along with blood test and colonoscopy. As per that, biopsy sample was also taken from two different sites. Barium meal test was also done. So it was found out the patient was suffering from tuberculosis, and the patient was put on anti-tuberculosis treatment as well for 6 months. Two biopsy samples which was taken during the colonoscopy did not indicate any cancer, okay, any malignancy. But again, after put on tuberculosis, the patient didn't get any relief. After he consulted two other gastroenterologists who asked to repeat the colonoscopy and laparoscopy, and after that, it was understood that the patient may be suffering from cancer, and the appellant was informed that he was suffering from cancer, for which he was advised immediate surgery. But remember, the patient was put on anti-tuberculosis drugs for 6 months. So 6 months, the patient could have started cancer therapy much earlier, but since there was a delay in the in diagnosing cancer, okay, so post-surgical specimen report also was given from Rajiv Gandhi Cancer Institute. It confirmed that the appellant had cancerous growth, which had extended outside the ileal wall of the intestine. So even though the patient was on tuberculosis medication, it will not work because cancer medication should have been given here, and the patient went into T3 stage, third stage of cancer. So here when the court hearing was given, the state commission referred this case to the PGI Chandigarh case, and the 3-member medical board reached to the opinion that the patient was treated appropriately just because cancer was not diagnosed on time, but the doctors could do whatever whatever was in their capacity, with the limited diagnosis, whatever was there in their capacity, they have given the treatment for it. Due care was given to it. Okay, just because there was a misdiagnosis of cancer, it doesn't mean the doctors have to undergo compensation, or the hospital has to give the compensation, because there are doctors and respondents with whom and all the patient had interacted. They were well qualified to deal with this case, and they did give them proper treatment and diagnosis, as proper medication and care. But the diagnosis was the only thing that was wrong, and wrong diagnosis again is not the foundation to file a charge or give compensation. So there was no medical negligence established in this particular case as well. So that's all about certain medical legal issues in medicine.